We're intimately involved as human beings, not just as physicians, in exploring and understanding the experience of patients when they enter the healthcare system and what's important to them. And oftentimes that experience helps us and has helped me understand what is salient and what's important in an imaging data set. And it's not just counting numbers and looking at pixels, but rather understanding the patient that's behind all of those images and what's important to them. You always want to be a physician that primarily does no harm and is always making a positive impact in your patients' lives. What I always try to do is every time I perform a procedure, I want to make sure that the patient experiences as little pain as possible. And so if I'm doing an injection or if I'm doing a procedure, which is even minimally invasive, it's a true reward for me to hear that the patient underwent something that they felt was just a little bit of a irritation rather than something that they thought was painful or invasive or in some way that interfered with their well-being. And so it's very gratifying to hear those comments. It's one of the things that actually makes you want to come back to work so that you can hear those comments again and again. It validates your role as a professional physician.